Good morning. Today we'll be talking about sarcoma. So sarcoma is considered one of the forgotten cancers, which July is actually the World Sarcoma Month. So we'll be starting with it and finding out much more about it. Thank you, Dr. Habeebu. It's always a pleasure to have you with us on the program.
Welcome, man. Welcome.
Thank you. Now, I just wanted to, I must say, I love your background. Beautiful, showing all the good work that and good things that are available at the NSIA Cancer Center. But what I'd like to first start off with is, what is sarcoma? Why do they call it forgotten? What's forgotten about it?
Well, sarcoma is a group of tumor, neoplastic disease, that's cancerous lesions, but they are lesions formed from connective tissue, either bone, cartilage, muscles, fat, all the connective tissue. It could even be blood. These are cancers from this, primarily from these tissues. And the sarcoma incidence, even though it's not high, is less than 1% of all cancer. But in a country like Nigeria with over 2 million, we still see a lot of patients with sarcoma. And sarcoma is also more common in the extremes of life, both the young and the old. We have different types for the young, for example, Ewing sarcoma, and we have the osteosarcoma, liposarcoma for the aged. So sarcoma can literally affect all age, but it's more common in the extreme of lives. Yes. Thank you.
Okay. So for those who are, thinking to themselves, what do you mean connective tissue? How is it different from other cancers? What are the similarities between sarcoma and other cancers? And then what are the differences?
Yes. Sarcoma, like I said, the connective tissues are tissues that support the main organs. For example, the bone, the muscle, they support the heart, they support the lungs, they support the brain. So they themselves, they are not highly specialized. They are just connective. They are supportive tissue. The sarcomas and other cancers are similar in that when it starts, as in they have the ability to spread to other parts of the body. So they can metastasize, that's the word we use. They can spread to other parts of the body, and this is the similarity. The difference is that sarcomas are, like I said, only primary to the connective tissue. They originate from connective tissues, while other cancers are from organs. For example, breast cancer is from the breast, cervical cancer from the cervix. There are some specific structures, but connective is just connective. It is not specific to a particular part of the body.
Okay, now that's interesting. So with that in mind, what kind of symptoms, signs and symptoms would people be looking out for in sarcomas?
So sarcoma, even though we have many types of sarcoma, but we can generally classify them into two. That's the soft tissue sarcoma and the bony sarcoma. And they manifest in different ways. For the bony sarcoma, they usually will present with pain and swelling. This also applies to the cartilage, that's the chondrosarcoma, and all the bony type of sarcomas. Whereas the soft tissue sarcoma, usually they present with a painless lump, which only become painful if it is unattended to and it continues to grow bigger, then invade the surrounding structure before we start having pain. The soft tissue sarcoma is about 3 times more common than the bony sarcomas.
Now, we talked about it, and some people will want to know, why do they need to know about it? Are they more aggressive, for example, than the other sarcomas or the other cancers? What's the difference between the two, and how does it relate, for example, to other cancers? Do they have a different kind of history? Are they milder, more aggressive? Do they respond to therapy? Because people are very interested in cancers now because they're so common.
Yes, sarcoma, we have varying degree, varying grades of sarcomas. That's what I mean is we have different type of sarcoma with different type of aggressiveness. Usually in children, their sarcomas are more aggressive than in adults. But generally, sarcomas are more difficult to treat because the connective tissues are more vascularized. They have more blood supply. And the presence of blood supply makes it easier for them to metastasize, that's to spread to distant sites. And a cancer that has spread to distant site is more difficult to handle than the one that is localized within a particular structure. Like I said, the connective tissue is loose. So most of the time, well, by the time we diagnose sarcoma, it has already spread. So making it very difficult to manage as opposed to the breast cancer, prostate cancer that can be confined for a long time before it spreads, and it can be treated more easily when it's still confined.
Okay, so that's actually quite alarming. So with people listening now, what should they be looking out for in themselves and in maybe relatives and friends to be able to say, this is something you really need to take seriously. This is something that you need to go out. Because a lot of people, for example, have lipomas. They tell you lipoma, oh, that's just a soft tissue swelling. Don't worry about it. So, should people who have lipomas be worried now? Should they be going to the hospital now? What should they do?
Yes. Now, if there's any new growth in the body, that's any swelling or any painful, any new site that you develop pain, bony pain, it must be investigated. If it is investigated, if it is the dangerous one, the sarcomas, the malignant sarcomas, yes, it will be dealt with appropriately. However, if it is lipoma, most of the time, lipomas are not problematic. However, they still need to be followed up, whether it is malignant or benign, that's whether it is cancerous or not, you must continue to evaluate it if it is not removed, because even though not very infrequently, but a supposed benign lesion can transform to become malignant later. So, but it's not the norm, but it can happen. So it needs to be, follow up reviewed so that if it does, then it is handled early.
Now, one of the cool things about this program is to talk about prevention. Is there any way we can prevent such cancers from forming?
Okay, so now that takes us to the cause. Most of the time, the sarcomas, they occur sporadically. That's, we cannot really say what is the cause. However, we know that those who are exposed to ionizing radiation may have sarcoma coming,
What is ionizing radiation?
Okay, X-rays, for example, we know that most of the time, if you want to go for unemployment, or there are many other reasons that may require that you do an X-ray. But we also use radiation to treat, like radiotherapy to treat. On those working around heavy machine that generates radiation, they also need to be on the lookout. Once you use radiation, you are predisposed to having this, even though the proportion, the percentage predisposition is not very high, but it's still higher than those who do not, Then there are a few other patients that has some syndromes, that's some genetic malformation. For example, what we call neurofibromatosis. You see some people with multiple nodules on their skin. That's how they are born. But you see that it continues to increase as they grow old. Such people need to, be very observant, because if any of those nodes continue to grow aggressively, it may be, it may turn out to be sarcoma. Then we have some syndrome like Lee-Fromeni syndrome, familial adenopathologic polyposis coli, that's in the GIT, and a few other symptoms that like retinoblastoma gene that can predispose to sarcomas. But all these ones you cannot easily see. So the ones we can see are like the neurofibromatosis. But the important thing is that any new growth must be duly investigated. Once you have a lump in your body or a growth you can feel that's not there before, it needs to be investigated.
Well, now that's so, we've had a lot of information about this But can you say, is there any, you've mentioned that it's, more common in the elderly, more common in the young ones, children. Is there any predisposition between males and females for any of these things?
Bone sarcoma, for example, are more common in males. We have more predisposition for bone in males. However, generally, sarcomas can occur in both sexes. There is no difference, only that bone may be more common in males than females. Apart from that, but bone sarcoma is not the most common. The soft tissue is more common. And this one has no sex predisposition.
It can happen in anybody.
Yes, it can in anyone.
Wow. Now that's actually quite intense, because you've told us that these cancers can occur. They can occur in all parts of the body. And the worrying thing about what you've said is that treatment is not readily available. So what should we in our own environment, how do we handle this?
Okay. Yeah, even though the treatment is not readily available, but the NSI Elite Cancer Center is one center that has all the complements of treatment for sarcomas. The NSI Elite Cancer Center is the most equipped center in West Africa and in sub-Saharan Africa for treatment of sarcomas. So we have a few other teaching hospitals that can also handle malignancies, that's cancer. So the theme is that we should do more of screening. If there's any lump or tumor, it should be screened. And if it is detected, you can come to NSI Elite Cancer Center. It can be referred to NSI. You get the full complement of treatment.
Thank you very much. Thank you, Pastor Lanre, for coming on the program to share your experience with us. You've started a foundation, a specific foundation on sarcoma. Can you tell us, why did you start it? What made you start this foundation in your name?
Yeah, thank you, Dr. Pamela. I had the incidence of sarcoma when I was just 10 years old. I was in primary 4 then, and then it was a very small growth, and nobody linked it with cancer, and it continued to grow until 7 years after, when I had to go to the hospital to remove the lump, and so it was removed in 85, and there was no follow-up test, or there was nothing done to actually examine what was removed. So we thought it was just a lump, and then it has been removed, and that was it. So we forgot about it until about 10 years after a recurrence happened that occasioned for another surgery, and so it was removed. And subsequently, there were other recurrences until about 2001. In all, I had about 7 surgeries on my head. Wow. The lumps were growing on the head, on the side of my head, in the scalp. And so it was just the grace of God that I survived those dangerous surgeries, very dangerous surgeries on the head. So the last surgery was actually in 2008, when there was another growth, and then there was another surgery. I began to wonder, how much I've really gone through, and then why did I go through all this? A lot of questions in my mind. And then in 2014, it occurred to me that I think I have something to tell the world about my story, especially in the area of awareness, because so in all, I went through sarcoma for about 30 years, from age 10 to about age 40. So, and then I understood at the end of the day that one of the reasons my case took that long was ignorance. We were not aware until 2001, when the lump were removed and taken to laboratory for the first time. We never knew the lumps were or had anything to do with cancer. We were thinking it was attack. We're linking those things to spiritual things. A lot of ignorance. And so in 2001, we knew that those lumps were cancerous. They were malignant. They were not benign. So so 2014, I thought about putting up a platform where I can tell my story and then can help people to be aware of cancers, especially sarcoma, and then to help people also who may be going through one form of cancer or the other, especially sarcoma, in terms of helping them to survive the ordeal. So that was the genesis of the Lanre Jacobs Sarcoma Cancer Foundation.
That's fantastic. Thank you so much. I mean, I think you've been through so much. And as you say, it's the grace of God. And obviously, the thank God for the good doctors that you have had that have actually worked with you and through God's grace helped to keep you to this point. Now, it's a wonderful thing that you've done to set up a foundation. And I know there may be one or two people out there who may think, you know what? I relate to this story. I relate to this sarcoma. I know somebody who's had it or who may have had it, or I think that I would like to support you. So can you give me a number or tell us how somebody listening to this program today, if they want to reach out to you, to support you, how can they do so?
Well, it'd be my phone number, personal number.
Yes.
Okay.
Yes.
Okay. My personal line is 081 3013 3902.
Please repeat it.
081 3013 3902.
No, that's fantastic. Okay, so thank you so much for sharing that with us.
Actually, Dr. Habeebu, he talked about sarcoma and mentioned. I would like to mention quickly that the tumors that I had, it was soft tissue sarcoma, DFSP in particular, dermatofibrosarcoma, and it was malignant. So I think that is very important for the world to know what kind of sarcoma did actually go through, what kind of sarcoma happened on the head in the scalp, and they grew to balloon sizes, at different times. No,
that's important. And I think what I like that you've shared with us is the fact that, the common thing in our own environment, something happens to you, instead of thinking about it medically, everybody wants to blame something spiritual. Somebody wants to blame something else for it. But there are medical reasons. And we need to also address the fact that if there's a lump and you have it removed, please, people should insist on having a diagnosis. Because a lot of people don't know, and they say, they removed it. And there are enough labs available which can give you a diagnosis that people need to know. It's so important that they need to know. And I'm hoping the people are listening here and they find out what exactly is wrong, because sometimes it doesn't go away. And you need to know what happened. So thank you so much for sharing that.
Thank you. So in our concerning the foundation, we work with the Lagos State government, the Ministry of Health, and the Healthcare Board. We have an official approval to go to all the primary healthcare centers in Lagos State and the communities in the state to do cancer awareness, especially on sarcoma. And like what you just said, and from my personal experience, from what we've seen so far, also in the field, a lot of people are keeping quiet about their cases. Cases not presented early enough for diagnosis and early treatment. And then you see WHO telling us that 4 out of 5 people that have cancer in Nigeria die of the disease, and it's so pathetic. And so a lot of awareness is needed out there, to let people know that cancer is on the rise, and that, yes, while the spiritual may have its impact in the issue of disease treatment or sicknesses or whatever, but God also has given as an empowered man to put up the medical, for treatments and for survival in cases where people have diseases or sicknesses.
Thank you, Pastor Lanre. I think that's an important message to get across. Dr. Habeebu, Professor Dr. Habeebu,
Yes.
Pastor Lanre's condition, do you have any comments on what he has to say, and in particular about how to raise awareness in our communities?
Yes, the truth is that what he has just said is classical. Most of the time, cancer cases are seen as spiritual, and this results in delay. Then the specific type Pastor Lanre had was dermatofibroma protuberans. It's a type of cancer that does not metastasize fast. It's a slow grow. We usually call it intermediate grade, cancer. But it has the propensity to recur. If you remove it, it recur. If you remove it, it takes a long while before it metastasizes. But he is very lucky. It was actually diagnosed before metastasis. So that is why with good treatment, he had treatment in NSI Youth Cancer Center. I've known him. He was one of our patients, and he is one that was successfully treated. So he is lucky that it was diagnosed. But for many Nigerians, what they have is usually more aggressive, and they still go through this spiritual method, and they get metastasized, get really bad before they are sent back by those who say they treat them spiritually. When they see it's out of hand, they push them to loot. So that's why casualties as high as what he said.
So how do we get the awareness out into the community? How much more can we do? Because we need people to be aware. We need people to come in. A lot of people say, I can't go into hospital. Hospital is where people die.
Yes, sponsorship. This kind of program should be sponsored. This program in particular needs to be sponsored so it can come more frequently. We can air it more frequently, and this will raise awareness, because people need to be aware. And it's with such program that you raise awareness, and then they know that when they have it, they can come to the hospital rather than remain in spiritual houses. Because the key to cancer treatment is orthodox treatment. You can use spiritual to support whatever you do. After all, spiritually, you can enhance whatever you do with, by spiritual means, if we believe in that. But you still have to do what you have to do. Nobody stays at home and pray for salary to come. You need to go out there to work for your salary to come. The same way, you don't just stay at home you pray for treatment. You need to come to a hospital, then you use prayer to back it up. Thank you.
Thank you so much. I think time is already fast spent. Do you have any last words for our listeners?
Yes, my last word is that the sarcoma, cancer generally, is real. And the first time is the best time. The first time it's diagnosed is the best time, because cancer does not wait. So if you go through alternative routes for treatment of cancer, you are not going direct, then you are going to end up with alternative results. So get the right result, you have to go through the right route, which is the orthodox route. So screening is key, and then prompt treatment is key once it's diagnosed. NSI Youth Cancer Center is the most equipped and most proficient care center for cancer care in West Africa and Sub-Saharan Africa. So it's a center to be if you are diagnosed of cancer. Thank you.
Thank you very much.
Thank you for watching. Please like, share, and subscribe. for new video updates.